Hello, my name is Dr. Marianne Shallcross-Smith. I welcome you to viewing this educational video that will give you insight and techniques for your growth in teaching children with special needs. Thank you for taking your precious time to learn about special education and how it relates to your work with children with special needs, as we call it, therapeutic childcare. You are about to be introduced to techniques that will enhance your interaction with all children. Working with children is a team approach. Please don't hesitate to reach out to your administrator, the therapeutic team, or the vice president of education, or me at Dr. Daycare at drdaycare.com for more educational pointers. Thank you very much.
Isn't every child special? We think so. But what do we mean when we say children with special needs? This means any child who might need extra help because of a behavioral, social, emotional, medical, or developmental delay. These children have special needs because they might need medicine, therapy, or extra help in school, stuff that children don't typically need or only need once in a while. This doesn't mean children with special needs aren't smart or talented or capable, just that they have specific challenges that a typically developing student might not face. Inclusion is simply providing children with special needs the opportunity to take part in classes and activities just like children their age without special needs. Inclusion involves more than just education for many parents and children. Inclusive classroom settings and participation in activities may be beneficial for helping children with special needs develop better social skills. Therapeutic Childcare Services is an inclusion program for children with behavioral, social, emotional, and developmental delays. The therapeutic program gives children the opportunity to attend, learn, and play in the child care setting. Children participate in activities and opportunities throughout the day with their typically developing peers. We recognize that every child is an individual and make modifications and accommodations based on each child's needs. Our goal is to give all children the opportunity to succeed. The benefits of children being in an inclusion program is that they are exposed to positive peer models. 25% of the inclusion classroom is dedicated to children participating in the therapeutic program. Therapeutic Childcare Services is a Kids Connect program regulated by the Executive Office of Health and Human Services in Rhode Island. The Kids Connect program was created in 2007 by a group of professionals who were concerned about the number of children who were being asked to leave their child care placement due to challenging behaviors and undiagnosed special needs. The therapeutic team consists of a special needs program director, licensed clinicians, a therapeutic integration specialist, and all the direct service staff members who assist with children with special needs. Therapeutic Childcare Services believes in teamwork to meet the individual needs of each child. The role of the Therapeutic Special Needs Program Director is to oversee and supervise the operations of the therapeutic program. A clinician is a licensed mental health provider who supervises the support services directly to the classroom and child care center on a weekly basis. The clinician will spend a half an hour per child per week giving direction, modeling new techniques and strategies, and evaluating the progress of each child. An example of this would be if you have 4 children in your classroom who are enrolled in the therapeutic program, the clinician will visit your classroom 2 hours per week, a half an hour per child. The therapeutic integration specialist, referred to as a TIS, works with the children in the TCCS program on a daily basis, and is an employee of the Child Care Center. The role of the TIS is critical for the child's success. The TIS devotes many hours with the children participating in the Therapeutic Child Care Services program, and the TIS's feedback and recommendations are valued and needed. The TIS is responsible to report data and attendance to the clinician on a weekly basis. Information or changes shared from the clinician should be delivered by the TIS to other direct service staff members. The therapeutic team encourages and needs feedback from the TIS and all teachers in the classroom. All direct service staff members are part of the therapeutic team. This includes administrators, teachers, teacher assistants, and any other employee that comes in contact with the children in the therapeutic program. Teamwork is important for success while working in the TCCS classroom. All teachers are responsible for all of the children in the classroom. At no time should the TIS feel that he or she is the only teacher who is responsible for the children in the therapeutic program. All teachers are there for all children. Last but certainly not least, the parents and guardians are always part of the therapeutic team. Without parental approval, input, and participation, children are not able to be enrolled in the therapeutic program. All classrooms participating in the therapeutic program must maintain DCYF ratio +1. Another way of understanding this is that there is an additional teacher in the classroom, typically a TIS, when a child who is enrolled in the therapeutic program is in attendance. An example would be if there are 20 students in a 4-year-old classroom, the DCYF ratio states that there must be 2 teachers present. If this is a therapeutic classroom and therapeutic children are in attendance, there would be 3 teachers present. In order for a child to enroll in the therapeutic program, they must have active Medicaid health insurance or be enrolled in Katie Beckett. If you feel any child would benefit from therapeutic services, please inform your administrator. When an administrator is approaching a parent about enrolling their child in therapeutic child care services, please understand the sensitivity of this topic. It is our job as a team to remain professional and courteous to parents when we speak about behavioral concerns or special needs. We should always introduce parents to the Therapeutic Child Care Services program in a positive manner, focusing on the benefits of the program. An example of this would be, your child has the opportunity to participate in a program that will provide additional supports in your child's classroom. Please keep in mind that maintaining confidentiality is important. When discussing any child or family concern, you should use discretion on how, when, and where you communicate. When a confidential discussion needs to happen about a child's challenges, please plan the time and place when the child is not present to overhear adult conversations. Maintain professionalism and confidentiality when talking about sensitive subjects with other teachers. A typical therapeutic enrollment process includes these steps. Step 1, referral. A completed referral form is sent to the TCCS team. A child can be referred to the TCCS program by parents, teachers, administrators, state agencies, or community programs. See the referral form for specific details. Step 2, intake. Once a child is determined to be eligible for the program, the site clinician will contact the parent to set up a date and time for intake. The intake attendees should include the clinician, the parents or guardians, the administrator or assistant administrator, the therapeutic integration specialist if possible, and any other agencies the family identifies. During the intake process, the clinician will complete a family assessment that includes the cognitive, social-emotional, and environmental history of the child. Parents are a very important part of a child's success and should be included in every part of the therapeutic enrollment process. Therapeutic child care services cannot be given to a child without parent approval and signature. Step 3. Therapeutic Integration Plan. Tip. Preparation. Based on the facts gathered during the intake, a therapeutic integration plan, TIP, is written for the child. After the TIP is complete, a parent TIP approval meeting occurs. Data sheets are prepared for the classroom, a therapeutic integration specialist is identified, and the clinician completes a classroom ratio form. During this step, the child's information is inserted into the classroom's TCCS binder. This binder includes each Therapeutic Child Care Services child's TIP, data sheet, attendance sheet, TIS training schedule, and any other information that will assist the therapeutic integration specialist in meeting all the child's needs. The data sheet is used to calculate the progress and challenges for each child. When filling out a weekly data sheet, please keep in mind that being accurate helps us best understand the child's progress. Step 4. Child-specific orientation. All direct service staff who will be working with the child are trained on the child's specific needs. This is called a child-specific orientation, CSO. The training happens in the classroom, either during nap time or another time that is convenient for everyone. After this training, the child may begin the TCCS program. Step 5. TIP implementation. Teachers utilize modifications and interventions in the classroom as outlined in the TIP and taught during the CSO training. Weekly TCCS attendance sheets and data sheets are completed and submitted by the TIS. See each form for specific details. Step 6. Clinical visits. The clinician will visit the classroom weekly for a half hour per child per week. The clinician models techniques, offers strategies, and evaluates progress. Step 7. Therapeutic Progress Report, TPR, written. After the child has been enrolled for 6 months, the clinician will evaluate and collect data to prepare a progress report called the TPR. Step 8. TIP renewal. Each year, the clinician will rewrite the child's therapeutic integration plan based on the child's progress and needs. This new plan may include changes in goals, strategies, and interventions. Each year, the TIP implementation repeats itself from step 3 through 8. An area of the classroom that helps children to be successful throughout the day is having a designated safe zone. The safe zone is an area located in each classroom as a place for children to utilize voluntarily when they feel they need to take a break. The safe zone is a child-directed activity, which means that the child can choose whether or not to use the area. Children should have the opportunity to freely utilize the safe zone throughout the day. A teacher may encourage a child to use the safe zone if he or she is being unsafe to themselves or others, and only if redirection has not decreased the aggressive behaviors. Our first goal is to redirect children to another activity. The safe zone is not timeout. Timeout is not appropriate for young children because it doesn't teach children an understanding of the situation and how to process their emotions and feelings. Timeout is often confused with punishment rather than teaching, and it is important to make every moment with a child a teachable moment. The safe zone teaches self-regulation. Self-regulation is when a child is able to control his or her own body and emotions. Help children to transition from a negative behavior to a more positive behavior. Use positive language while in close proximity while the child is experiencing a challenging moment. Being specific and giving clear directions to children will help them process their emotions. Suggested strategies for redirecting children. Acknowledge the behavior and give an alternative choice. Verbal direction should be clear and simple. Don't ask the child questions. Engage children in an activity that they choose. Sell it to the child. Always use positive redirection in positive language. Tell them what they should do, not what they shouldn't do. Provide alternative activities when a child is unable to maintain or feel safe in a large group activity. Remember, the goal is to have the child return to the large group. Use positive words that are specific to the child's observed challenges. When redirecting children is not an option and a child refuses to move from one area to another upon your request, be sure that you are using preferred activities that would encourage that child to move to another area. When a child has an incident or injury, a report should be completed. At Dr. Daycare and Kids Club, we refer to this as Incident and Injury Report. It is important to document the date, time, and details of incident or injury. For an incident or injury that occurs with a child in the therapeutic program, this report must be shared immediately with the program director and clinician. Clear, factual documentation is vital for determining the next steps for the child. When challenging behaviors become more consistent and the child has 3 or more incident reports, a specialized plan should be written. At Dr. Daycare and Kids Club, we refer to this plan as a behavior plan. This behavior plan is a plan prepared in collaboration with the classroom teachers, administrators, and the special needs program director to respond with interventions and strategies to help the child be successful. For children participating in the therapeutic program who have unsafe, consistent, challenging behaviors, a safety plan will be developed by the clinician. A meeting will take place with the parent, guardian, clinician, administrator, and TCCS program director. The safety plan will be monitored weekly by the TCCS team. A safety plan can only be developed by a member of the TCCS team. If the behavior plan or safety plan does not aid in the improvement of a child's behavior within a reasonable amount of time, the child may be dismissed from the program or referred to a higher level of care outside agency based on the child's needs. We make every possible effort to keep children in their classroom and participating in their programs. One of the reasons that our program has been so successful at working with children with challenging behaviors is constant and consistently training our staff. Therapeutic Child Care Services offers monthly therapeutic integration specialist trainings on topics that teach, assist, and educate teachers on how to respond to challenging behaviors. TIS specialists are encouraged and expected to attend these specialized trainings as part of their job description. These trainings are a great opportunity to meet our therapeutic integration specialist and to collaborate, network, and share ideas.